taking time for your health. The African American Wellness Watch. Trusted information for us, by us. Dr. Mike LENOR and other experts from around the country and around the world have the latest on how you and your family can get healthy and stay well.
Welcome to today's edition of the Wellness Watch. We are indeed fortunate to have as our guest Dr. Ron Kennedy Bailey. Dr. Bailey is a psychiatrist, and the president-elect of the American Psychiatric Association. He was the 113th president of the National Medical Association. He is currently Assistant Dean for Health Equity at Louisiana State University Health Center and Psychiatric Medical Director at Orleans Parish Criminal Justice Center. I could go on and on and on about Dr. Bailey, but that won't give us much time to discuss all the things that I think we need to in the time that we have. Welcome to today's edition of the Wellness Watch, Dr. Bailey, and congratulations on your recent election as the president of the American Psychiatric Association. Quite an accomplishment. We are very proud. It just so happens that you're the first African-American president, Black president of that association. Is that correct, or have there been others before you?
No, I am the first Black male to be president. I'm also the first Louisiana-based person. It's pretty much been an issue for the coast. A lot of doctors from New York and California. And I think I'm also the first who identifies as a forensic correctional psychiatrist. So definitely a lot of firsts, but the bottom line is the challenges that we have remain the same.
Okay, let's start with what are some of the biggest challenges that you think you face, not only as an organization, but as you individually?
I think as an organization, first, I'd say that we need to be better understood in the house of medicine. The reality is psychiatry is a medical subspecialty. I was on the phone with someone yesterday and they were asking me, what's the difference between a psychiatrist and a psychologist? And it's our responsibility to articulate that message very, very well. Psychiatrists are medical physicians who are trained in the medical model to treat brain-related illnesses. It's been confused over the years because neurologists often also treat brain-related illnesses that we consider to be a bit more tangible, having a stroke or a bleed or a hemorrhage. Our problems are of the brain, but they're a bit more intangible. Issues like clinical depression, anxiety, psychotic diagnoses like schizophrenia, schizoaffective disorder, those are the areas, I think, of psychiatry. But the four key themes that psychiatrists are responsible for are how you feel, depression, how you act behaviorally, like violence or fighting, how you think cognitively, can you function at work and at school, and of course, how you process information, whether you're psychotic or the like. Those are the four key areas that often cause people problems in life, and that's our responsibility to manage.
Yeah, I think that's become more important after the pandemic. I think we're starting to see many more people challenged by a number of things. Certainly the current environment that we have politically and internationally, but also because of the time that people had to reflect and didn't have so many busy things to do. I think a lot of them just took that time up to become anxious and depressed, and I think psychiatry has a big role to play. Well, what are some of those strengths that psychiatry brings as you face those challenges?
Well, psychiatry, I think, brings three primary strengths, I think, to the house of medicine and to take care of persons in our society that we should be responsible for and take umbrage in promoting. First and foremost, good quality communication between a doctor and a patient, the so-called therapeutic alliance, is the hallmark of good psychiatry. There's a lot to be said in that space, but the big issue is that we should be good listeners as well as any other physician. And often we can actually help patients articulate the message of what their problems are, not only to us, but also other physicians within, I think, their level of care. That has to be, I think, again, one of our strengths going forward. Secondly, also there's a triangular consideration in medicine between doctors and patients and hospital staff. Psychiatrists often in the area of what's called consultation psychiatry work to bridge that gap. Early in my career, of over a decade ago, or maybe 2 decades ago now, I was the consultation liaison psychiatrist, and liaison is a key term, at Herman Hospital, a big private hospital in downtown Houston, for the transplant service. And all too often, the main reason why there'll be difficulties or challenges in having a successful surgery and successful results after surgery of a transplant with communication between patients, their families, their doctors, and staff. It was my job, my role then, to bridge that gap and enhance, I think, a better level of communication so that better outcomes could occur for a patient who needed optimized coordination of care. And there's our effort to kind of put that forward. And the third and final point I mentioned is psychiatry also has to be responsible, I think, for emphasizing that empathy and resourcefulness and resilience are not just issues of themes within psychiatry, but the entirety of medicine. And we have to, I think, be leaders and focusing on that aspect of medicine. It's not just all machines and biology and technology. It's also about people. That's our space.
Could you explain that last one a little bit more, in a little bit more clear language? So I didn't quite understand what that third pillar was.
Well, the idea is that in medicine, even in my career, I finished medical school, University of Texas in 1990, 35 years ago, there were fewer machines. There was less technology. There was less risk, I think, of AI and Chat GPT, how you communicate. There were less other vectors between the doctor speaking with the patient to push the process forward. And some would argue that we've lost some of the valuable attributes of the doctor-patient relationship in all of medicine, in part due to many of the gains we've made over the last 1 or 2 or 3 decades in the advancement and enhancement of the use of technology and technological spheres, I think, in our practice. So psychiatry has to not just focus on these concerns in regards to what we're doing in mental health, but also, I think, to be leaders in the entirety, I think, of the medical practice as we engage with, I think, other practitioners of medicine, with not only patients, but their families, if you will. Also, after you're speaking to companies and third-party payers to focus, I think, on this process. So the concept of empathy and resourcefulness, and I use the term resilience, must remain, I think, prominent in the doctor-patient relationship. That has to be an area that psychiatry promotes.
Do you think, just from my own perspective, that the public has a different impression of psychiatry as a tool in wellness? I mean, most of the time when you see psychiatrists, they're talking to some serial killer that they just got, or they're being interviewing a prisoner somewhere, or they are planning some kind of half-crazed scheme. And you don't see much in the media on psychiatry as a contribution to wellness. Can you change some of that?
Well said. I think that you said a bit of an idea. The reality is most of what we're doing, and I don't mean 51%, but I mean 90+% is standard, day-to-day, normative, and kind of routine care. And all too often in that setting, that's lost with those cases that are 1 in 10 or 1 or 100 when it's extreme. You know, jails and prisons and violence and serial killers, as you mentioned, those issues are important and demand the time that they require. But they probably would the media consideration of such allows many persons in regular society to misunderstand much of the nuts and bolts and the boots on the ground, so to speak, of the regular day-to-day interaction of psychiatric medicine and psychiatric mental health providers with our patients and families and our communities.
Yeah, I think that's an important piece, that people need to start to see psychiatry more as a component of wellness rather than simply when people eating dogs and killing people and serials on. I've seen a variety of different programs where the psychiatrist is always brought in to talk to somebody who is probably not unable to appreciate anything that you're talking about. And so I think seeing psychiatry as a wellness issue, I think is very important from my perspective. And I know you to be that kind of psychiatrist, and I hope you can feed that into the fabric of the American Psychiatric Association.
I'd like to. I'd simply add, but I think that what you speak to, I think very articulately, I think is the issue of proactive, healthcare. Or we talk a lot in medicine now about not only mental health care, but when you combine it with primary care, this idea of collaborative care, that's really, I think, the theory. And I actually like to take a little bit further. I had a colleague, Dr. Elliot Sorrell, on the East Coast in the DC area for years, who liked to describe what he called total care, psychiatric quality care, primary quality care, and a public health, within a public health scope. When you do all of those issues and think about them much more globally, I think you can address many of the long-term challenges that we've had in medicine for some time that are more difficult to manage and treat singularly or with short-term vector approaches. So your description of wellness, which is proactive, is preventative, it occurs further up the chain before the tertiary level problems come to play, I think is exactly right. That's where our focus should be.
I remember when you were the 113th president of the National Medical Association, I asked you what was going to be your biggest focus. And you said stigma. And I kind of laughed at that because first of all, I didn't know what it was like. You know, I kind of mixed it up with something like smegma. But I mean, I didn't know what you were talking about. But of course, I've learned over the period of the last several years that that is one of the biggest problems, not only for you, but particularly in communities of color. What do you intend to do? And now that you have a much broader brush, how do you intend to paint that issue of stigma across the landscape?
Look, at a timely point, and I think my opportunity will be very unique because, as you point out, I think very correctly, I am an African-American psychiatrist, and I think both areas, healthcare for African-Americans in our country now, currently, as in the distant past, as well as healthcare for those of all ethnic backgrounds and racial backgrounds who have primary brain-related illnesses or psychiatric concerns, both areas have been unfortunate recipients of the scourge of stigma. Many people don't understand it, so they don't give it the attention that it deserves. B, we've had very practical and pragmatic approaches at the governmental level and the private industry level that has been costly. It's actually cost fiscal concerns by trying to cut budgets and have increasing impediments to care. Very often psych patients with a brain illness have higher copays to see their doctor. You're less likely to go for preventative care. They have a lower lifetime cap, so you're a lot more likely to run out of all your resources at some point. And very often there are just many more challenges. Early in my career, we spent a lot of time fighting when somebody was needed to get into the hospital to either get them into the hospital or for them to stay so many days. Based on what the empirical data said, they need to be there to actually get better. There's always a big push to get psychiatric patients out of the hospital earlier. For all three of those reasons and more, we've struggled with stigma. That's why it's important for us to, I think, use educational messages like we're trying to do today. So I thank you for the opportunity to be on your show to get the point across to all of society, especially those who I think press the button of finances, that psychiatric care is beneficial to the whole society when it's done in a best-in-class, empirically based, performative way.
Yeah, I think that's been one of the big issues in the communities. I know that you have a particular interest in communities that don't have adequate resources in psychiatry. That's those poor communities, homeless communities, ethnic communities as well. The whole issue around racism as a major psychiatric underpinning of a lot of problems, not only for African Americans, but for poor American, not racism, let's say. That's kind of a stigma issue, but racism has become one of those issues that they're talking a lot more about as a major factor in the development, mental health development of African Americans, and Latinos, and other people of color.
Yeah, clearly, I think that ethnic issues of race and discriminatory bias, we see these issues, I think, in gender now. Increasingly, there are efforts by many groups, by differing groups, I should say, to block progress and access to care for women. If women can't get quality health care, they, by definition, are a lot more likely to be at a higher risk of psychiatric complications, clinical depression, long-term generalized anxiety problems, and others, post-traumatic stress disorder, come to mind. So I think that we have to have an active and a vibrant response mechanism. We in the National Medical Association, where you're right, I was 113th president, just like yourself, and moving forward as a future president of the American Psychiatric Association, been involved since it's been an organization since 1850, almost 200 years. And I've been involved for 30 years, and the group has worked consistently with incremental growth to address these challenges, I think, over time. The election of myself, I think, hopefully will do several things. And one is to bring to forbearance some of these concerns of stigma, of issues regarding fairness and care for many, and also I think of issues regarding concerns regarding what we call global mental health. I've been involved in these issues internationally, and And often I make the argument that some of the same challenges that occur internationally, we're experiencing in urban areas right here in the U.S. So there's a lot of work to do, and we need to get started.
You know, it sounds like it's a pretty big agenda. What are your priorities in all the things that we're talking about?
I think that there are three, four. The first issue, of course, is make sure that we capture and galvanize the current strategic plan and move forward in that regard. And that has to be our priority. The three items that I spoke about a lot during the campaign were fiscal issues, as you point out, stigma issues, treatment issues, and global mental health issues such as trauma. On fiscal issues, a lot to be said for organizations bringing in funds from external sources. But I'm very interested in the active psychiatric provider. As I came here as chairman of psychiatry at LSU in New Orleans in June of 21. I was chairman of Wake Forest before that for 4 years, and then Meharry before that. I've noticed over the course of what's now 15 years, pretty much in these roles as the chairman, how more of our young doctors can't simply get a clinical practice in one area and see it grow. All too often, they have to fragment and space their practice out because you have to work in one place where you enjoy doing that work, some other place where you can ensure you earn enough income to pay all of the necessary bills. So I think we should be much more pragmatic in our approach, that we should protect our doctors the best we can so they can practice in the optimal way that they've been trained and whether their heart pushes them towards their passion in psychiatry. Next, I think on the issue of stigma or discriminatory bias, the entire consideration comes into play that we have to educate others, as your earlier questions gave me a chance to, of who we are and what we can do. That speaks to issues of access, getting access to care. There should be adequate and optimal funding at the highest level, the government level, for what we do, because we have to take care of persons who can't take care of themselves. They're often in state hospitals. They're often children in county facilities. They sometimes may be in jails or prisons. So often they don't have private insurance, but they need to require as individuals, and we as a society need for them to receive optimized care that's empirically based on what the data says is best in class so they can get better and at some point get remission for the illness, not move to alcohol and drugs, which people often will do to self-medicate or try to address the problems that they're not having addressed appropriately by a trained psychiatric provider. And the final point is the issue regarding global mental health. And really that weasels its way for me to the issue of trauma. Way too much trauma, too much unknown trauma against young people, trauma against young girls in our society. We should speak out against that. We should make sure the person get into care early. We don't want persons to have a long life of psychiatric sequelae and hurdles and difficulty because they had trauma earlier physically that wasn't addressed emotionally, psychiatrically, and psychologically with good quality psychiatric intervention.
Well, you know, that's a pretty big agenda. And anytime you are president of an association, you're kind of leading an army. And everybody didn't vote for you, obviously.
Right.
What do you say? What's your battle cry? I can't use that when I talk to psychiatrists. What is your agenda as it relates to your fellow psychiatrists? Well, what are you saying to them that makes them excited about your leadership?
I think my theme is going to be that there's more that binds us together than separates us apart. And I know it may be a previously used theme, but it means a lot to me. It means a lot to me in my prior work, like with yourself, in groups like the National Medical Association, where I've learned the value of camaraderie and teamwork and collaborative working together as a team to accomplish a certain objective. I can also say that what binds us together is important because all too often, various aspects of medicine will be fragmented. And I think that psychiatry is an area of medicine, as was spoken of earlier, that has a tremendous opportunity to find ways to blend and merge and galvanize, I think, congruency among different areas of care. Often when our patients come to see us, they have more than one medical problem. Yeah, they have psychiatric problems. They have the depression or anxiety, but they also have hypertension. They may also have asthma. They may also have some degree of having had a prior stroke. So they're thinking about their medical problem and a psychiatric problem, and they shouldn't have to make a choice between the two. We should have to figure out ways to combine the considerations, understand the data points, and find ways to get on one clear trajectory moving forward to help them find recovery for their problems. And the third point, I think, is also just so true. This idea that more binds us together is important because we probably have this three-headed consideration of care, government, and private enterprise. And I think the American Psychiatric Association has done a good job in the past. We want to do a better job going forward of linking these three primary theme objects to find ways to not work against each other, but to find ways to work in a coordinated fashion that's effortless and more efficient for those in American society.
Dr. Ron Kennedy Bailey, thank you very much. I'm sure with my experience with you in leadership with the American Psychiatric Association has made a very good choice. And you are the right man with the right job at the right time. So thank you so much for joining us on today's edition of the Wellness Watch. We look forward to your leadership and your continuous involvement with the Wellness Watch, keeping us abreast of what's important in the areas that we're concerned about in psychiatry.
Thank you so much. Really enjoyed it, Lenore.
Well, that ends today's edition of the Wellness Watch, sponsored by the African American Wellness Project. Stay with us every week. We have not only the Wellness Watch, but the Black Doctors Speak podcast and a variety of publications in the social media space. But as we always say as we end our program, health is your biggest asset, so protect it.